Imagine you've developed a life-saving injectable antibiotic. The formulation is perfect, stability studies are positive, and clinical results are excellent. But when it reaches patients, reports come back: discoloration, reduced potency, even unexpected side effects. What went wrong? The culprit, believe it or not, was not the drug, but the glass container it was packed in. Today, let's explore how pharmacopoeias guide us in evaluating glass containers to prevent exactly this situation. Glass is the most widely used packaging material in pharmacy. It looks inert, but can interact with formulations. Problems: alkali leaching, pH changes, turbidity, flaking. So pharmacopoeias, IP, USP, BP, EP, lay down evaluation tests. Let's understand this through a real-world case. A pharma company released an IV antibiotic in type 3 glass vials. After storage at 40 degrees C/75% RH, the solution became cloudy. Investigation: alkali leached from the glass, destabilizing the drug. Lesson: wrong choice of container can ruin the formulation. 1. Hydrolytic resistance test. Purpose: checks how much alkali leaches into solution. Methods differ for powdered glass and whole container. Powdered glass test: crush glass, wash, autoclave with purified water, titrate leached alkali with acid. Measured as ml of 0.02 NaCl consumed. Pharmacopoeias give limits for each glass. Type D, whole container test. Fill actual containers with purified water, autoclave, titrate extract. More practical for finished containers. 2. Surface etching and surface glass test, USP-EP, to check surface resistance of the container wall. Involves treating with acid and then evaluating hydrolytic resistance. 3. Light transmission test, SPRO for amber glass. Ensures protection from UV and visible light. Important for light-sensitive drugs like vitamins, hormones. Type 1, borosilicate, highly resistant for parenterals, sensitive formulations. Type 2, treated soda lime. Surface treated, suitable for acidic, neutral parenterals. Type 3, regular soda lime, for non-parenteral aqueous/non-aqueous preparations. Type 4, general purpose, mostly for oral solids dry powders. In our earlier antibiotic case, using type 1 instead of type 3 could have prevented the problem. Part 4, practical learning segment for students. Show a simple demonstration of powdered glass test. Crush a sample of glass vial. Wash and autoclave with purified water. Collect extract. Titrate with standard acid using methyl red indicator. Compare with pharmacopoeial limits. If your titration requires more acid than the limit, what does it mean for your container? Answer: poor resistance, not suitable for sensitive formulations. Tie the antibiotic failure back to the practical test outcome. Emphasize how evaluation is not just academic, but protects patient safety. So we learned that glass containers are not just passive packaging. They must pass strict evaluation tests like hydrolytic resistance and light transmission, as guided by official pharmacopoeias. The wrong glass can ruin the best drug. The right glass ensures stability, safety, and efficacy for the patient. Remember, in pharmacy practice, even the container can decide the fate of the medicine.
Found this video helpful, please subscribe, like, and share it with others who'd benefit. See you in the next video.